now going to address frequency of visits and patient compliance. Keys to success in surgery involve the excellence of the surgery, but they also require the follow-up process, and the two need to work together to provide the best of results. While it might seem obvious that follow-up is crucial for lap band outcomes, we actually don't have direct evidence that more intensive follow-up leads to more consistent results. However, there are lots of information from observational and indirect data that the intensity of follow-up does impact on outcomes. And of course, there's absolutely clear evidence from other chronic disease management that that better compliance, better follow-up does indeed lead to important improvements in clinical outcomes. So the intensity does affect on the outcomes. And particularly importantly, when we look at medical weight loss management programs, when the compliance and follow-up is absolutely critical to success. So we need to set the scene for our patients from the start, recognising that all of our patients have failed previous weight loss methods. Patients should have consistent and realistic expectations. There's a need for the patients to understand the importance of compliance, the importance of adjustments, and the consequences of poor compliance. That is, poor results, but also an increased risk of complications. So, how do we develop patient compliance? Patient compliance needs to be a partnership between the patient and the practice. It needs to be based on trust and understanding. We need to provide that environment in which a patient is heard. We need to be good listeners. We need to refrain from dominating and taking over the conversation during visits. We need an empathy, and every member of the team needs an empathy with the problem of obesity. Patients fear being judged or told off when they put on weight. If they're fearful of coming back, they won't come back, and we most need to see them when they're doing poorly. Frequency of contact is really critical for long-term outcomes, and when patients, there are a number of ways you can interact with your patients. There's not only the visits, but there can be newsletters, there can be emails, and of course there can be groups that get together to talk about their experiences. Remember, our patients often suffer from stigmatisation and discrimination, so we need to provide a consistent message and a consistent helping team. Now, if we look at the evidence, there's a figure from our data, from a study that we've had published in the last couple of years, looking at the relationship between the number of visits in the first year and the weight loss in that first year. And you'll see here that on average our patients achieve around 20% of weight loss in the first year. But if they have fewer than 7 or 8 visits, and particularly even up to 7 or 8 visits, the weight loss is poor. And those that have less than 5 visits have an unacceptable weight loss with less than 10% of weight loss at 1 year. We will see that our average patient has 12 visits in the first year, a standard deviation of 4, and the average number of adjustments is just under 8. We have further data from a group in New York showing that with the lap band system, there's a consistently lower average weight loss in patients who are followed up less than 6 times in the first year compared to those more than 6. It's important in this particular study to show that the gastric bypass, that the follow-up in the first year wasn't critical for weight loss, but we now have good evidence that it's critical for weight loss in the long term. I want to emphasise that there's a strong responsibility for follow-up with gastric bypass. Here are 2 studies which show that the effect of follow-up is important. It's important to recognise that gastric bypass and all bariatric surgery needs good follow-up. Here are 2 studies from the US that show that focus on the importance of follow-up after gastric bypass. Patients must be encouraged to continue with their bariatric medical appointments, and it's important payers need to understand that this isn't an operation a set and forget, that long-term follow-up is required. The second study shows that a significant number of patients will not comply with regular follow-up after laparoscopic gastric bypass unless they are prompted to do so by the clinic. These patients have poorer outcomes. We also have indirect evidence that follow-up is important from 2 randomised trials that compared the band with the bypass. Actually, out at 5 years, the banding results were quite good, probably a little below average. However, the planned first year was to have just 4 visits in each of these studies, 4 visits in the first year for both the gastric band and the gastric bypass patients. Now, if we look at the data from our work and the New York work, we understand that 4 visits is not going to give optimal weight loss, and indeed did not give optimal weight loss in these randomised controlled trials. So when we look at the total care meeting, now the total care meeting was a large meeting set up in the United States in early 2009, where some hundreds of surgeons came together to discuss good, very successful practices, big practices in the United States, came together to discuss the importance of aspects of practice, and they put their ideas together and pooled their thoughts. And in fact, I'll have a number of slides on this total care meeting. But here you will, in this figure, we'll see that that the percentage of patients, the number of visits that surgeons provide in the first year is on average 4 to 6. In fact, in the first 6 months is 4 to 6, and 67% of practices provided 4 to 6 visits in the first 6 months, and most providing more than 3. So it's important to understand that in the United States, the key players are providing large numbers of visits in that first year. We have a number of obstacles to patient compliance with their regular visits, and these are the views from the practices as to why patients aren't coming back. First of all, a patient is doing well and they don't need to be seen for regular visits. Missing presumed cured is not a good idea. We also find that patients who are doing poorly may fear recriminations from the practice if they come back. We have patients who have just given up. They've given up on many other programs, and they give up on this one. We also have problems of distance. Patients who are further from the practice have greater difficulties. Patients who are well away from the practice have difficulties. Relocation is an issue, patients who've moved areas, and of course there are financial considerations to follow up. And we need to address all those with our practices. When we think about it, looking at these obstacles, we need to think about how available are we in our practice? How available are you and your team? How welcoming are you to your patients who are doing poorly? Or perhaps patients who have given up? How do you deal with the issues of relocation and distance? How do you deal with patients who are lost to follow-up? What sort of reminders do you send out? And what efforts are made to re-engage patients? And when patients are re-engaged, are they made to feel welcome? Many practices use re-engagement policies. They have them automated. They have automatic emails or reminders or phone calls out to patients. And other practices find that an open door policy is very successful in retaining patients. Many Australian practices have an open door policy where patients are welcome to make as many appointments as they like and to really feel that they're welcome at any time. Other practices, of course, will have an open door policy, particularly if a complication is expected. While other practices set up satellite centres and other centres for looking after patients that are some distance. So in conclusion, frequency of visits and patient compliance. Frequency of visits is a key, especially during the first year with the band. Effective follow-up and proper adjustments ensure a successful outcome. Helping the patient to be compliant is a responsibility of the practice, and we must build that feeling of partnership and trust with our patients.